Hello, and welcome to our presentation. This is Michael Long narrating on heroin replacement therapy for myself and Sylvester Nicholson for Neurobiology of Addiction, ADC 655 with Aspen University. Heroin addiction has reached epidemic proportions and overwhelmed the resources available to address the problem in many communities in the United States. Consequently, new and innovative ways of dealing with the issue are being employed, including the use of prescription medicines and other scientific methods. The effects of opioids most sought after include euphoric feelings of ecstasy, followed by sedation. Heroin use leads to physical addiction, and users begin to experience intense withdrawal symptoms within a few hours after the drug is metabolized. Although these effects usually only last from a few days to a week, many users succumb to their cravings and continue to abuse heroin. Pharmacological and scientific therapies assist by easing or eliminating withdrawal symptoms. When a substance is so addictive that an individual will risk losing everyone and everything they value in life just to keep using, where do they turn to for help? Well, psychotherapy has been a staple in this battle. Pharmaceutical and scientific treatments now exist to augment traditional counseling efforts. But how effective are these options? Do they cause more harm than good? Please follow along to learn about the types of treatment and the pros and cons of these therapies and decide for yourself. The slides which follow will outline the types of pharmacological and scientific therapies available to help treat heroin addiction. Additionally, they will examine the pros and cons of these treatments and offer an analysis as to their effectiveness at treating addiction. Heroin replacement therapies include a variety of pharmacological options that are supposed to assist the user with avoiding or reducing the effects of withdrawal. These therapies include methadone treatment, Suboxone treatment, heroin medical grade treatment, and naltrexone treatment. There are basically three types of brain stimulation used to treat addiction. TMS, or transcranial magnetic stimulation, which involves magnetic energy passing through the skull. TDCS, or transcranial direct current stimulation, which involves applying a 9-volt direct current to the skull. And DBS, deep brain stimulation. DBS involves surgically implanting electrodes into the brain, which then deliver electrical pulses that artificially stimulate the release of neurotransmitters to help ease addictive cravings. The pros of these treatments, methadone and Suboxone, are that they allow users to live relatively normal lives without the negative, intoxicating effects associated with heroin. These drugs, if used as prescribed, have similar effects on opioid receptors in the brain without causing intoxication and prevent the individual from going through withdrawal. They reduce the cravings and withdrawal symptoms because it's a full opioid agonist. A pro of using medical grade heroin is that the purity of the drug is assured, which reduces the risk of overdose. It doesn't totally eliminate it. And it is administered by medical professionals, so sanitary equipment is used, which also helps prevent the transmission of communicable blood-borne diseases. The benefit of each therapy is a corresponding reduction in crime because addicts no longer need to steal to support their addiction. Providing one of these treatments is more economical than incarcerating a user and reduces the unintended consequences on the addict's life and lives of their family members, i.e., jail, loss of job. The concept with these drugs is that they are used under the watchful eye of a doctor and that they allow a user to focus when combined with cognitive behavioral treatments with the ultimate goal of being to taper use over time until no longer needed. Pros of heroin medical grade and naltrexone. Medical grade heroin still involves the intoxicating effects. However, it is considered to be safer than street heroin, which is of unknown quality and strength, reducing the risk of overdose. It is also dispensed under sanitary conditions, thus lessening the chances of contracting communicable diseases. Naltrexone is long-lasting opioid antagonist, meaning that it blocks the effects of opioids as well as other drugs with few reported side effects. The pros of brain stimulation. TMS has shown promise with curbing alcohol use, and TVCS has shown promise with curbing alcohol and cocaine use. DBS has only had limited human test subjects and has led to reduced cravings, but not abstinence in subjects. The cons of methadone and Suboxone. Methadone has the potential of being abused and must be administered in a healthcare setting on a regular basis. This adds to the expense of the treatment and can interfere with holding down a regular job. It is also an extremely powerful drug and can be abused. Suboxone is very expensive and can also be abused by addicts. It is rarely effective alone and often used in conjunction with CBT or cognitive behavioral therapy. Careful monitoring and tapering by healthcare professionals to wean someone off these drugs is essential to a successful recovery. The administration of medical grade heroin may solve the supply problem for the user, but it does not address the underlying issue of addiction. It also carries the continued risk of abuse and potential overdose. Naltrexone carries mild side effects with its use, and for some users, it has been reported to negatively affect liver functioning, so LFTs must be monitored closely when it's prescribed. Brain stimulation has only been narrowly tested on human subjects and primarily found to be effective with treating alcohol and cocaine addiction. DBS involves invasive surgical procedures, making it more personally intrusive than other forms of treatment. As these technologies continue to develop, they may also prove useful in achieving abstinence. In conclusion, the members of the group had some differences in opinion. One felt treating heroin with heroin is both cheaper and more effective than methadone, and felt that politics plays a strong role in determining which treatment was most likely to be employed, even though evidence from other countries supported his belief. It has been reported by the United Nations that there are between 15 to 21 million regular users of heroin worldwide. The other member of the group felt naltrexone was the best choice, as it was the most versatile drug, relatively inexpensive, and had few negative side effects, but also realized that treatment must be specifically tailored to best meet the needs of the individual. We must remain open-minded and receptive to new ideas, as well as vigilant to the fact that medications and science, for that matter, rarely work alone without some form of psychotherapy. The future looks bright and holds promise that a cure, possibly in the form of a vaccine, will be discovered. Until that day, though, research must continue and treatments must be carefully monitored to ensure the lives of people suffering from addiction continue to improve. Thank you very much. Have a good day. This concludes our presentation.